Good evening. Thank you for joining us today. I am Trish White, the Family Education Manager at CHADD and the moderator throughout this presentation. Parent to Parent is an evidence-informed educational program provided by parents to parents. This educational webinar series for adults with ADHD who have children with ADHD is sponsored by Takeda Pharmaceuticals. You will be provided with a brief presentation followed by the opportunity to ask our presenter your questions. You may submit your question by typing them into the question box in the GoToWebinar control panel. This educational series includes 1 hour-long webinars that cover a variety of topics that are important for you to learn about. In addition to tonight's presentation, they include recognizing and overcoming the barriers, defining the problems at home, strategies and treatment options that help with everyday parenting challenges, that's this evening, setting realistic goals, and communication and interpersonal skills to resolve conflict with your child. CHADD was founded in 1987 and it is the premier nonprofit where those with ADHD and others who care about them get unbiased, fact-based information about ADHD. CHADD produces educational materials, including Attention Magazine, and organizes in-person and online educational trainings and events like this one. The National Resource Center on ADHD is the CDC-funded National Clearinghouse for evidence-based information about ADHD. Please visit our website to learn more about the benefits of becoming a member of CHADD's ADHD community of parents, adults with ADHD, educators, and professionals. And now I would like to introduce our presenter, Eva OMalley. Eva OMalley has ADHD and a child with ADHD. She's been involved in her community and at CHADD's national level for many years. Most recently, she served on the Society for Developmental and Behavioral Pediatrics Complex ADHD Treatment Guideline Committee, that's a mouthful, as a former member of CHADD's board of directors and as a chapter coordinator. Eva provides families with the knowledge, resources, and support they need to manage and succeed when affected by ADHD. So now I'm going to hand it over to Eva. Thank you very much, Eva.
Thank you, Trish. That was wonderful. Hi, everybody. My name is Eva OMalley, and I live here in New Jersey. I've been a chapter coordinator for CHADD for 12 years. That means I've held parent and adult with ADHD support groups since 2007. I hope my math is right. But I've been doing it for a while now. My son was who brought me to CHADD. He was diagnosed when he was 7. So what are some of the mistakes that are most often made by parents with ADHD when parents themselves have ADHD? And the answer to that is what you're thinking. Different than the mistakes parents who don't have ADHD. It doesn't preclude you too much from making a lot of mistakes. It precludes you maybe to making the same ones more often. And that kind of goes hand in hand with what goes on with ADHD. When I was diagnosed, it was kind of, wow, okay, now I get it. Now I know why this was happening. And now I know why I didn't see it or I didn't recognize it as being a problem. So over time, we get to take a look at things with full hindsight, which I didn't have because for 7 years between my son's diagnosis and mine, I wasn't treated. And treatment for me began in 2007. Went to my doctor. He did a screening. I helped him with the screening because I was very knowledgeable about it at that point. We decided to try a trial of medication. Now, 12 years later, I can say there is a very big difference between the way I can perform now before I was receiving treatment. And of course, treatment also doesn't just mean getting a prescription. It means becoming educated and knowing what the doctors know and knowing more than the doctors, and just bringing your A game with that, because a lot of misinformation is out there, and it's also shared in the clinical community. So we have to be more informed than your average person on the topic. Some of the things I've noticed over time, problematic when you have ADHD, and I don't think it's any different with families that don't have ADHD, but this is one that's a little tougher, is when your child points out that you're not doing something that you are asking them to do. There have been cases where my kids would point stuff out to me like, well, you haven't showered yet today, or, other things of that nature. And in response to that, I think the best way to answer those kind of things are, wow, you know what? You're taking, your care very seriously, I see. Just come back at it with a positive answer as much as you can possibly muster. It's hard to model for them when you are also struggling. In the case of perhaps smoking and trying to finish work on time, trying to do some of the things that we know aren't the best role models for our kids. And partly because of our ADHD. I smoked, I tried, I think 3 times to quit. And when I went back in the first and second time, my kids were little and they really didn't notice I had stopped. So they really didn't know I went back either. So they didn't tell my husband because it just wasn't a thing. So it didn't become an issue, but it started to become an issue when they started to get a little older and still smoking, and wanted to try to get rid of that. But I didn't know at that point in time about my ADHD, and a lot of times smoking is a way to self-medicate. It's a stimulant, nicotine, so it's very hard to give it up. It's addictive, and you kind of feel a lot better. It's kind of like coffee too. Coffee can be habit forming. We don't have perfect parents anywhere, so ADHD does make it a little harder to overcome some of those things that we struggle with. Making those rules are easy, but following them is hard. And remembering what you had said about them and that they may have been punished or on restriction is hard. I've had my kids tell me a bunch of times, I can't do that. And I'm like, why? And you're punished me. It's like, oh, that's right. So it undermines your authority when you cannot remember to follow through with restrictions and punishments. And a lot of times, I know people who are raising kids with ADHD, those things don't even work anyway. But, kids will need this in their day. They will need those boundaries. And so demonstrating to them that you can put a system in place for such a thing is helpful. And I would rely heavily on my phone for reminding me, even in those early days. When we were all, I think, using Blackberries, I would try to put notes in there for myself to remind myself if I did put my kids on restriction for whatever reason, when it started, when it began. In order to make something help you, it has to be external, and you cannot rely on your internal cues and your internal memory to come online automatically. So you have to make whatever it is you need to remember physical. And I think showing your kids that you're doing this is great, because nobody's perfect and everybody has to make accommodations for themselves. Parents, I think, sometimes get caught up in thinking that they're got to be perfect. Adults with ADHD make mistakes, pretty much the same mistakes that everybody else will. Not listening to our partner's concerns or being dismissive, talking at each other instead of communicating. The best one, you already know what the other person is going to say because you've been with them for a long time. Or say speaking over them so we don't forget our train of thought. One of the things that I have tried to do is remind myself that when the other person is speaking, not to be thinking of what my response is, to be mindful and in the moment about what it is that they're saying. If the other spouse doesn't have ADHD, or if they do, it can be difficult for a lot of different reasons. When you both have it, hopefully you don't have the same set of symptoms. With my husband, I figured he doesn't have such a terrible memory, but I do. Thankfully, we managed to raise 3 kids without too much problem. But I think really getting the relationship in a good place, explaining what you need from your partner. Because of your ADHD, I have to tell my husband, don't read off a list of things we got to do. He likes nothing more to brain dump in the same room as I'm in. We've got to do this, we got to do that, we got to do that, and then after that, and then I'm not going to remember this. And he says, but I told you. And I'm like, yeah. So at the time that he's doing this, thinking out loud, I have to remind him, okay, I can only hold on to one piece of information at a time. Of course, this gets easier once you guys know what it is that is the bigger issue in your relationship. Always being honest with one another about how things are moving along. This one is one we had an extremely hard time with. Saying no to your child and everyone else for that matter. One of our friends through Chad is a woman by the name of Paxson, and she wrote an article about how to set limits on saying no. One of the things that she emphasized was it's a major mistake to relent. If your child learns that they can harass you into yes, they will also learn to manipulate you whenever they want something. The fastest way to a bad habit is to reinforce it intermittently. And by gosh, this is what happened with my son. When he became so perseverant and so persistent on what he wanted, he knew he could grind us down to a stump until we just are exhausted, because his skill level of accepting our will was completely zero. That meant he did not have any ability to accept the imposition of our will as parents on him. And it was so difficult to do almost anything. And it was so difficult to refuse him, because we have 2 other kids in our family and they would have to endure the tantrum that was going to happen because we were saying no. So I'm sure there are families out there that are nodding their heads at this point. And I know that the other kids in the family, if they're not affected, or maybe even if they are affected, they feel really different. They feel like they're being treated different, or the child with ADHD gets anything that they want. And it's really hard to explain to those kids that they're the ones with the disorder, though. That they're not doing this because they stood up all night, and thought about it and wanted to ruin everybody's day. This is a disorder where, it's really hard for the other kids to understand. But I think she made it very clear that this is something you have to take in hand, and no is a full sentence sometimes, and for other people as well. So, but saying no categorically for everything somebody asks you after a while just turns you off. So it's the same as it is with your kids, it should be with the other things in your life. If you're the one that everybody asks for everything, no is no. Don't feel that I used to feel this way, that people then didn't like you. I guess as I got older, I kind of got over that. For a while, I didn't care as much, but in the beginning, I did. If you have ADHD and you know that sometimes things can come out very quickly without you thinking about it, with a lot of extra grease on it. It just slips out. You don't mean to say it. I think I cursed at my son once, and it sounded so ridiculous coming out of my mouth that he laughed at me. Again, it doesn't work either, but I think your inner voice that you have, it's a bully. Forgiveness is for everyone. It's not just for you to be able to bestow on your children. It's the way your children learn empathy too. Tomorrow is the next day, and whatever happens after the day you found out about your ADHD or about your child's ADHD and you have regrets in those areas, you just have to wipe that slate clean and say, I didn't know. I was doing the best with what I had at the time and with what I knew at the time. So it's important that we forgive not only ourselves and not only our kids, I should say, and we should forgive ourselves, not worry too much about it, because you do apologize to them and they learn how to apologize back. They learn that it's okay to ask for help, especially. That's one of the things I think you can demonstrate for your kids, is how to ask for help, especially when you're struggling with things that, you don't want them to view as okay. When you do so, you demonstrate for them what that is. that you need to do to get better. So saying to them, you know, mom's tired of smoking. I don't want you to have to watch me do that, or whatever it is that you want to stop doing. And I'm going to get some help for that. And our whole family is going to help me to kick it, or to feel better about it, or whatever the task at hand is. Mr. Rogers' voice is truly opposite to that of our harsh, self-critical inner voice. So I leave you with, today you've made this day a special day by just your being you. Mr. Rogers follows up with saying, there is no person in the world like you, and I like you just the way you are.
Thank you, Eva. I have a quick question here that came in a little bit earlier from Daniel. He asks, does nicotine react with medication for ADHD, or does it continue to work as a stimulant after diagnosis starts?
I quit smoking before I started medication, and this is of course just me. So I can't answer that, but I did have to stop taking caffeinated products because I would get that fluttering you feel in your heart. It's harmless, but it's kind of like you don't really want to be aware of your heart every minute of the day. So I would think that quitting smoking would probably be really important before you go on a stimulant, because I don't think you want to add the two of them together.
From Michelle, how do you deal with the morning routine, and how can you as a mother stay calm when meds aren't kicking in yet?
Okay. Well, if you're taking a stimulant medicine, it should kick in right away. If you're taking a medication that's like Strattera or something off-label for ADHD, and it does take a while for it to kick in, I would say give yourself a crazy amount of time and you will be right on time. So if it seems like really too much time to do something, then you're right on point. So, because I always say to myself, oh, I could do that in 20 minutes. And 20 minutes turns into an hour. And I know this about myself. So I always make sure that I give myself, like I said, a crazy amount of time to get ready. Getting up in the morning with ADHD is horrible. It's not an easy task to do, to transition out of sleep. Ergo, the coffee drinkers of the world. This is something that is difficult, even with medication. And I take my medication when my alarm goes off. And then I do it early in the morning, and then I snooze it. And the medication, I go back to sleep, and the medication wakes me up at the same time every day when I do that, because it helps ease you naturally out of sleep. Because what the medication is doing is helping those areas of your brain to function the way that a typical brain functions. So it functions more like people who don't have ADHD. So we medicated our child at 5:30 every morning. That's when my husband would get up, because he would commute into the city, and every day, same time. The medication would get online in about an hour. My son would get up and right off to school, right to the bus. Didn't stop to go, nothing. He didn't like waiting. As far as little kids and routine, do as much as you possibly can the night before, and make their routine start right after dinner, because if you wait too long, they're going to get their second wind, and it's going to be much harder to put them to bed. I think if you divide and conquer, if you have a partner at that time, hopefully at night, to divide and conquer, the routine a little bit. But if you're worried that your ADHD is, or you have ADHD, to get evaluated as quick as you possibly can, because there's no need to live life unaided. For me, it was like putting on a pair of glasses, and I enjoy living the way somebody who doesn't have ADHD now more than I ever did because of the help of the medication. Not like it doesn't change the fact that you have ADHD, but it helps you to live more as if you didn't. And that's what's so remarkable about getting, but treatment is a lot of different things. It's not just not just medication. Actually, the most important treatment for you and your child is education. So what you're doing right now is the most important part of treatment for you and for your child. And that is just getting, like I said before, getting crazy educated on ADHD, knowing more than the doctors do. And this is the place to get it. Chad, if it wasn't for Chad, I probably wouldn't be here talking to you, first of all, but I wouldn't have had the types of experiences and headed off some of the experiences that the older people in Chad have been able to shine a light on my path for. You learn that in some cases, your stuff is not as bad. And in other cases, you have hope because they made it through and their kids are grown and their kids are doing well, and they're there because they had each other to help. And it feels just like that. It feels like you have people that understand what's going on, and they're not rolling their eyes when you're talking about this stuff. They're nodding their head because they live the same day you do.
Yes, thank you, Eva. I have another question for Michelle. I'm going to kind of elaborate on it a little bit because she asks, how do you deal with executive function? And I'm going to add, do you have any tools that you rely on regularly? Do you rely on your spouse? Is there resentment from your spouse on you relying on them? Things like that. So how do you get through your day? What do you rely on? What tools do you use?
I'm a big user of my phone, and let me just touch on two different things. There are symptoms of ADHD, and then there are functional impairments. The symptoms are the list of things that you see when you look at the diagnostic criteria. That's inability to focus on tedious things, and you fidget and so on and so forth. But the functional impairments, and medication helps the symptoms. That's pretty much the only evidence-based treatment for ADHD is medication for the symptoms, for the core symptoms of ADHD, which is inattention, hyperactivity, impulsivity. And functional impairments are what happens when you're not accessing that part of your brain that helps you with all those things that you do. And those things are the things that you do to yourself. So your inhibition, your working memory, your emotional regulation, planning and problem solving, and your self-talk, the voice in your mind that breaks things down for you and is that narrative from the minute you wake up to the minute that you go to sleep, of the things that you're going to do, that you're proposing to do, and then breaking it down and doing. And that self-talk is sometimes missing pieces. And when you realize that you actually have this self-talk and you start to listen to you listening to you, you start to realize that sometimes there's pieces missing. And I can't jump from this part to this part because, oh, wow, yeah, I got to do all of this in between. Over time, functional impairments like that get better, because once you access that part of your brain, you start to develop that part of your brain, and it becomes more reliable too. It becomes where you don't think about it like turning on, it gives you the answer as it should. And you don't really have to think too much about it. So to answer the question, anything that you want to do that is internal or that is your executive skills, those things that I mentioned, anything you want to do, you have to make physical, you have to make external. So if you want to change the oil in your car, you have to remember to put a sock in the middle of the hallway. Anything novel, anything that'll remind you to do what you have to do, or when you have a deadline at work to do something and it's extremely boring, you chunk it down into little pieces over the time that you need to do it. And you look in that self-talk, or that mind mapping actually is another executive skill that we have, of how to break down things and how to get to that place where that project is finished. And some people write it out in an outline. Some people will put it as a little bit of time each day. And some people will get a coach. A coach is, there's ADHD coaches. I think the whole idea started off as life coaching. But basically the people that they were serving were people who had executive function deficits, and those were adults with ADHD. Prior to the understanding that ADHD is a lifespan disorder, people thought kids, they outgrew ADHD at a certain point. And most of the time is because all of that kind of stuff went internal and you didn't, speak out loud about what you were proposing to do. So if you want to make something happen, you have to put it out in the physical world. And you also have to have help at the point that you're doing it. So we call it the point of performance. And anything directed at that activity that isn't at that time is not going to help, because it's a performance problem. It's not a knowledge problem. You know how to do it. You don't know when to do it. And that's also ties into when people say ADHD, there's a problem with time management, or the overall sense of time, which includes your hindsight and your foresight. So sometimes you're like, oh my God, how did I do this again? I keep doing this wrong. And that's why. It's because we cannot bring online the lesson we learned and the ability to fix that lesson, because it's a temporal kind of glitch in the way our brains function. So I think that's it. I think anything that's physical, like your phone, like Post-it notes, coaching, ADHD coaching is something you can look into. There's is it the American Coaching Organization, ACO? Is that what it stands for, Trish?
Yes.
Okay. They are a place where you can take a look, and coaching is something that actually I'm going to be doing. I had my first session with a coach today, and the fit, the relationship is always going to mitigate the outcome. So if you have a good fit with the coach and you know that you click, it's going to be something that you're going to enjoy, and you're going to close the gap from where you are to where you want to be with whatever it is. I don't know. I don't think insurance doesn't pay for anything anymore. So I'm going to just say that probably isn't going to be paid through any insurance, although some companies do offer something called flex funds. I know they offered it with my son when he was younger, and he wanted nothing to do with it, because at 15, he was emotionally 10, and at 25, he's emotionally maybe 17 or 18, because there is a delay with emotional growth and social growth with kids. Sometimes that gap can get bigger and include some adults, but I think if the ADHD is pretty bad, sometimes 30, 35 is the end of adolescence for people with ADHD. So we have another question.
Yes, thank you. Tara asks, I am a homeschooling mom. I have believed my entire life that I have ADHD. I am struggling more now than ever because of my busy life. I talked to a doctor about getting tested, and she said that doctors often will not help stay-at-home moms with ADHD because there is no one for them to be accountable to. I am shocked by this. That's my editorial comment. Do you have any suggestions on how, excuse me,
To find the right doctor for you? Yes, definitely. Good. First, like when we went looking and shopping for our pediatricians, we would conduct like a little phone interview. I did this 30 years ago with my daughter, and everybody was talking about how you're supposed to, qualify your doctor before bringing your baby there. And I was like, that's a great idea. And if they weren't going to speak to you on the phone, then they really weren't the right doctor for you. So this still holds true. Speaking to a doctor and asking some questions can help you find the right person. One of the first things you should ask a potential doctor is what percentage of your practice is in treating ADHD? And it should be pretty high, so that we know that right there the doctor has lots of experience and he has an interest in it. Also, the second thing I would ask them is what organizations are they affiliated with? Developmental pediatricians, they're associated with the Society for Developmental and Behavioral Pediatrics. Most pediatricians are associated with the American Academy of Pediatrics, and doctors who have a special interest in ADHD, they are going to be probably members of the American Society of Attention-Related Disorders, right? APSARD, did I get them all? And that's a good place to start. APSARD has a resource directory. Believe it or not, Psychology Today, although sometimes they'll list their interests there, and they'll put ADHD because, they want to, or, they feel that they should. But if it's not in like the description, it's under their picture. The way for Psychology Today is like, they have a little bit of a paragraph about, the philosophy of the clinician and how they run their practice or what their interest is. You want to see somebody that says, it's my great privilege to help people with adult ADHD. You want to see that interest. Or you find ADHD centers within like a bigger institution, such as through a hospital. In Pennsylvania, they have an adult ADHD program that used to be, I think, headed up, it might still be, by Dr. Rothstein. And he's a regular speaker at CHAD. And he does a lot for the ADHD, adult ADHD community, in as far as, getting videos and CMEs, which are continuing education credits, to primary care doctors who do a lot of the frontline work in, helping with patients who don't have access maybe to specialists in their area. And these CMEs are free. Actually, the resource is ADHDinadults.org. I hope that's right. And it'll be like a blue brain, and there is a link to the National Association of Continuing Education for doctors, and it'll be free CME classes to get them trained in how to treat adult ADHD. So if you like your doctor, but the doctor is saying to you, I really don't want to go that way, I don't know a lot about it, you have something. You could say you can get trained and be confident about helping people in your practice live better lives because they're going to have some treatment. But along with the treatment comes the education piece. That is the top thing. And sticking with Chad is the best thing you can do because they keep it all real and they keep it all fresh. And you're not reading biased information. You're reading it as it comes. So yeah, that wasn't really nice of that doctor. I don't think I would want to go back. So
Okay,
like I said, you got to know more than the doctors, and that's where you got to start, is in education.
thank you.
Anyone else?
Yes. Jessica asks, any recommendations on how to discover what motivates your child regarding school? Although
Mm,
I have ADHD, I was so driven to succeed in school, and my daughter seems to be the opposite. I
right.
understand school is really hard for her, but her effort seems so minimal, and I can't figure out how to help her get more invested.
Well, ADHD does kind of preclude us to not having that same amount of ability to think about something and create that motivational state as people who do not have ADHD. Even when we're talking about like washing the dishes or doing the laundry, some people find it absolutely like I absolutely hate emptying the dishwasher, and it's just something that's not I'm crazy about. So that kind of piece of it gets put to the side. But when you're a kid and is she in middle school or in grade school? Because if she's in middle school, it's kind of hitting that brick wall where you had like, one teacher and one schoolroom, and then you have 7 part-time jobs and 7 bosses, and at the end of the day, they tell you, guess what? You didn't finish your work at school. You have another
Yes.
2 hours. Yes?
Sixth grade. Sixth
Six-
grade.
Is that the first year of middle school?
Yes, I believe so. If
Yeah.
I can't
That's
remember.
that's kind of coming. It sounds like that she's overwhelmed, and in our middle school, every teacher gives you a form to sign about, what they expect in their classroom. And you literally have 7 part-time jobs. And then, you got to go home and you got to do 2 more hours of work. I don't think anybody on this call would agree that they would stay at that kind of job at all, ever. But yet we ask our kids to do this. And kids who have difficulty putting all of that in their mind's eye. I kind of liken it to when they asked me to take statistics, a subject I knew nothing about. And I felt so out of, I felt really much like a middle schooler in class, even though I've been through college. This was so foreign to me, and I felt like, wow, this is interesting, because now I kind of felt like what my son was feeling like in middle school, that I don't have anything to offer in this class. I don't know nothing, and I'm starting like from the bottom. That can be an overwhelming emotional response to what's going on right now with her in school. And I know this is like a very, what they call, noble point of development, and they are changing in every single way. They're changing physically, they're changing psychologically, emotionally. Um, uh, Everything is going to be different, and what's happening in their brain is there's what they call a lot of neuronal trimming, which means that the whatchamacallit, the brain starts to trim back on connections that it had made, and those connections are going to kind of be the permanent ones. So what's superfluous in the brain gets trimmed back. And this makes actually people, what they say, makes supposed to make people a little bit more flexible and during this time. So they, they can kind of cope with, all the demands that those 7 part-time jobs are throwing at them. She may not even realize that it's affecting her emotionally. And girls are really hard to admit that there are things happening that they can't handle. But if you talk to her, and there are great ways of bringing up conversations that don't feel like you're, out for information. Did you just, want to be mom and talk about them? I think some of the suggestions are to just go hang out in their room for a little while and, lay on their bed. Maybe they're doing homework or getting ready for the next day, and just say to them, wow, you got a really great room here, or something like that. And start to, if you need to bring it up, start to bring it up by saying, wow, I've noticed that you've been whatever, having this issue. What's up? And then let them talk, and let them talk as much as they can. And if they stop, say, well, tell me more. Then what happened? You want to kind of drill down a little bit to get to what the problem really is, and not just what the behavior is, because we really don't want to focus on that. We want to find out what the problem is so that they can help also figure out what the solution should be. And they should definitely get first crack at that solution. That's another webinar, but in answer to your question, to try to build your relationship a little bit with your daughter, check out Dr. Green's website. It's livesinthebalance.org, and it's Dr. Ross Green. He's actually going to be keynoting in Philadelphia this year, and his method is called Collaborative and Proactive Solutions, and it's amazing. It's a wonderful, respectful way to raise your kids. So,
Thank you.
Good. No problem.
Diane chimed in also regarding Jessica. She said that she found that communication with her son's teacher at middle school is very helpful, or observant on things, and helpful, I guess, in collaborating and working together to, work on these issues.
It is so helpful when you have teachers that are on that same level, that same wavelength that you are, and understand that kids will do better if all of their needs are met. And, as much as I read an article once that said, you raise your kids, I'll teach them French, which talked about how teachers, want to draw that line between becoming involved with their emotional and social education, and us looking at this like, you're getting my kid for the best 6 hours of their day. You better be you better be involved with their emotional and social growth. So it's kind of sometimes a tug of war, and I think hopefully that it's progressing in the direction where teachers are going to be getting more training, especially on neurodivergent kids, kids on the spectrum, kids who have mental health problems. And a lot of times mental health problems comes from having ADHD. In and of itself, ADHD is what we call a quantitative disorder. It's kind of like how tall you are, and it's second in hereditary to how tall you are. So it's highly genetic, but also it shares a lot of the same variants on the genome as autism, as bipolar disorder, as major depressive disorder, and schizophrenia. Those 5 disorders, even though ADHD is quantitative and the rest of them are qualitative, the rest of them are the diagnosis, and ADHD would be the coexisting part to that, you're going to see a lot of overlap and a lot of risk for having, I think 80% of the time there is a second diagnosis or mental health condition or learning disability, and 60% of the time there's two. So we say look for it. If ADHD medicine isn't working, it might not just be ADHD. Those are some of the big red flags out there that if it's not straightforward. And, you know, it's just simply, I think the world we live in is demanding a tremendous amount on kids these days. If they're going to do this with kids, I think they should be in school longer, but they should have more breaks. They should have breaks, period. The way they have it structured right now is like, it's nobody works like that in the real world, but kids are asked to go without ever getting a chance to consolidate the information that they've learned at certain points in the day and be able to, you know, refresh and regroup. As once your emotional fuel is gone, it's gone. And generally, if you have kids with ADHD, you know, for the most part, they're great at school, but when they walk through the door, all bets are off. And they are the Tasmanian devil, and they're very difficult to help at that point. They need to have some time to be able to, you know, be who they want to be.
I do want to remind everybody that we as an organization are always available for questions or concerns. So if you have any follow-up questions, feel free to contact me at parent@chad.org, and I will refer you to the appropriate person. And I want to thank Eva for presenting this evening and answering everybody's questions. And I want to thank everybody for coming. So thank you very much.
You're welcome, everybody. Like Trish said, Chad is available. They do have a warm line that you can call with questions to be able to speak to another parent. Just join Chad. Try to make it to the conference. Try to find a Chad group that's near you. And if there isn't one and you have a place where you could hold a meeting, just start one yourself. Chad, Trish, who do they call if they're interested in starting their own group?
That would be Jantel, but if they choose or they call our main number, they can choose that option. It's in the prompts, and they should be directed to the right person.
Oh, okay. If they want to start, you know, and you know, you don't have to do like one every month. You can do one every other month, or you know, 3 or 4 of them, or maybe even get one of the people who treats your child to come and do, you know, a presentation for the families that you invite. The school will be very helpful if you have a good school to ask for space. You know, they will say, yeah, come on Thursdays because the janitor's here because they have basketball practice on Thursdays or something like that. Chad will be able to help you with that kind of stuff, and I will too. So Trish, if anybody needs help in that way, let me know.
Okay.
Okay, thank you everybody, and lots of luck. And if you have any more questions, forward them on to Trish, right?
Yes.
Poor Trish. All right, dear. Have a great night, everyone. Thank you so much for being here, and please come back.
Yes, thank you. And everybody says thank you, Eva, so thank you.
Bye-bye, everyone.
Good night.
Good night.